Now to an incredible group using exercise to help heal from breast cancer, physically, mentally, and emotionally. A recent study shows exercise can help reduce the side effects of chemotherapy, and this group is proof it can do so much more. Friendship, strength, hope. There's a bond that brings these women closer together, and it's not just early morning row practice.
I'm Bridget and I have breast cancer.
I'm Jill and I have breast cancer.
I'm Nathalie. I'm a breast and ovarian cancer survivor.
These women are members of ROW, which stands for Recovery on Water, a nonprofit organization in Chicago that brings current breast cancer patients and breast cancer survivors together for rowing lessons, free of charge.
Since they go through an experience where they feel like they lose control of their body, it's a way for them to gain that power back and to have a proactive way of keeping cancer at bay.
It makes a difference to be surrounded by people that understand your experience. We can talk about armbands and we can talk about, what medicine are you on? Oh, I'm tired too. We can have that kind of banter, and then it's like, let's get in the water and let's row.
Research shows that working out during treatment may not only change the level of hormones linked to breast cancer, but it also decreases nausea, fatigue, and emotional distress. It can also decrease body fat and provide cardiovascular benefits, which may prolong survival.
It really helps not only emotionally, but the whole body. I have lymphedema in both my arms. It's gotten much better since I've started this.
My cancer spread up into my brain. My last couple of scans were pretty good, so I can only think that, this is helping me. I'm not sitting around feeling sorry for myself.
Definitely not.
I'm out doing it.
How I love that group of women. Jen Ashton is here, Dr. Jen Ashton. And so tell us how exercise can actually lower breast cancer.
So we don't know for sure, but there are a couple of theories here. And I want to do a little demonstration to really drive that point home too.
Back.
That's right, step back because there is a little bleach. So don't try this at home. What could go wrong?
And this is a rental.
So the first theory with exercise really has to do with inflammation and insulin. So insulin can be a good thing in small amounts, in large amounts, not such a good thing. So if you imagine this that I'm pouring in here as exercise, it really neutralizes the effect of inflammation and insulin on driving cancer. Second theory has to do with hormones and fat. So body fat produces estrogen. Some is good, too much, not so good. So again, if you think of this as exercise, it helps to neutralize the effects of that fat and estrogen on certain types of breast cancers. And the third one has to do with a substance called sex hormone binding globulin. You can think of this as the transporter of estrogen. So again, this is the exercise. It actually increases, so it doesn't make it disappear. It increases this sex hormone binding globulin, leaves less estrogen floating around to work on the breast tumor.
Very effective like that. So what type of exercise are we talking about here?
So we saw in that incredible piece, rowing. That's obviously cardiovascular. That has been shown to reduce the risk of recurrence and to prolong survival, and in some studies actually reduce the risk of breast cancer to begin with. So you want to get your cardio in, and of course we know about the endorphins that can help with head-to-toe wellness, but any type of exercise is so important, Robin. You want to do resistance training, you want to do weights, and in women recovering from surgery, range of motion, yoga, stretching, all really important for healing the entire body. Remember, it's about not just a body part, it's about head to toe and the whole organism.
So who should do this?
Definitely women who have just been diagnosed. Now, this is hard. Did you find it difficult to get moving when you were battling?
It was, because, we were bloated because of all the medication and that.
Exhausted.
And all of those things. But, because I was very active before, my doctor said, no, it did not prevent me from getting breast cancer. But, boy, did it really help me in fighting it.
And the recovery, exactly. So, I think that who should do it, certainly if you've been diagnosed, check with your doctor. If you've had surgery or you're undergoing chemo, you should be, even if it's sitting on a sofa and moving your legs. But the caregivers, men, the offspring, all of it, everyone.
I know it's so difficult. Breast cancer is not one size fits all, but if you can get up and move and do that, please, please, please. All right, Jen, thanks very much. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.